So for interventions for Terri's borderline personality disorder, start with that it's usually treated by some sort of combination of medicine and psychotherapy. The medicines that are used in treatment of borderline personality disorder aren't intended to cure that disease, but they are used to help with symptom management and also to treat co-occurring disorders. And those kinds of medicines are antidepressants, antipsychotics, anti-anxiety medicines, and mood stabilizers. There are four different kinds of psychotherapy that have been in some way or another empirically found to be effective in treating borderline personality disorder. The first is mentalization-based therapy, and that's it assumes that people can't separate ideas or thoughts in their head and behaviors. So it teaches people to be able to think about behaviors instead of just thinking and behaving at the same time, or behaving without thinking. The second kind is schema-focused therapy, and that operates under the assumption that people have maladaptive schemas or broad patterns of thinking, and that those maladaptive schemas cause a skewed view of the world, which causes problems in functioning. The third kind is transference-focused therapy, and that assumes that the problem is in our connections with other people and our relations with other people. And so that uses the interactions between the therapist and the client to try and teach the client certain interactions that they might not have learned earlier in life. And that brings me to another point, that all three of these types of therapy are linked with borderline personality disorder, because borderline personality disorder has a high co-occurrence with childhood abuse, and all three of these kinds of therapy teach skills or correct certain views of the world that it's assumed could have been the cause of childhood abuse or neglect. The fourth kind of psychotherapy is by far the most empirically based out of all of the different kinds, and that's dialectical behavioral therapy, or DBT. In terms of DBT, you have a skills group where you work on mindfulness skills, being in the moment, being aware of what you're doing, what you're thinking, your behavior, how it's affecting you. Interpersonal effectiveness, your interactions with other people, emotion regulation, and distress tolerance, where you're able to sit with something even though it's uncomfortable. This is going to be really good for Terri because she seems to have problems in all of these different categories. She seems to not be very mindful of what she's doing. She just seems to act without thinking. She seems to be very emotional and can't really regulate that, which is shown by her severe mood swings. And she doesn't seem to be very good with other people, getting what she wants or letting people understand what she needs, because of her relationship with Andy, due to the fact that she can't keep a job for more than 2 weeks, that sort of thing. So you take all of these skills and you combine them with certain CBT techniques and individual therapy, and get basically the most effective treatment for borderline personality that there is.